Slipped disc or herniated disc. Causes and symptoms. A herniated disc is a common condition that can be painful and debilitating. People also refer to it as a slipped disc or disc prolapse. In some cases, it can lead to pain, numbness, or weakness in the limbs. However, some people experience no pain, particularly if the disc does not press on any nerves. Symptoms normally reduce or resolve after a number of weeks, but a person may need surgery if they persist or get worse. Causes. A slipped disc occurs when the soft internal section of an intervertebral disc protrudes through the outer layer. The human backbone or spine consists of 26 bones called vertebra. Between each vertebra lie rubbery, cushion-like pads called disc. This disc help keep the vertebra in place and act as shock absorbers. Spinal disc have a soft jelly-like center and a tougher exterior. A herniated disc occurs when some of the soft interior slips out through a crack in the wall of the disc. This most commonly occurs in the low back, but can also occur in the vertebra of the neck. The escape of this jelly is thought to release chemicals that irritate nerves in the surrounding area and cause significant pain. The prolapsed disc may also put pressure on nerves and cause pain through compression. The cause of a leaking disc is usually gradual wear and overuse as a result of repeated movement over time. Spinal discs lose some of their water content as a person ages. This reduction in fluid makes the disc less supple and more prone to splitting. It is not always possible to recall the exact point when a disc problem begins, but it often occurs when lifting objects without bending at the knee or after twisting while lifting a heavy item. Risk factors. Herniated disc can occur at any age, but they are most common for men between the ages of 20 to 50 years. Factors that increase the likelihood include weight. Being overweight puts additional stress on the lower back. Genetics. A person might inherit a predisposition to herniated disc. Occupation. Individuals with physically demanding jobs or pastimes that involve pushing, pulling, or twisting are prone to herniated disc. Any repetitive activities that strain the spine can cause them. Unsafe lifting technique. People should always apply force from the legs, not the back, when lifting heavy items. Incorrect technique can lead to a herniated disc. Driving often. A combination of being seated or long periods and the vibrations and movements of the car can damage the disc and spinal structure. Sedentary lifestyle. A lack of exercise can lead to a herniated disc. Smoking. This might reduce oxygen supply to the disc and lead to a grinding down on the tissue. Symptoms. In some cases, a person will have no symptoms. If symptoms occur, they are often due to pressure on the nerves. Common symptoms can include numbness and tingling. This occurs in the region of the body that the nerve supplies. Weakness. This tends to occur in the muscles linked to the nerve, which may cause stumbling when walking. Pain. This occurs in the spine and can spread to the arms and legs. If the herniated disc is in the lower back, the pain often affects the buttocks, thighs, calves, and possibly the feet. This is often referred to as sciatica because the pain travels along the path of the sciatic nerve. If the problem occurs in the neck, the shoulders and arms normally experience the pain. Quick movements or sneezing might induce shooting pains. Complications. Below the waistline, the spinal cord separates into a group of individual nerves, collectively called the cauda equina or horsetail. In rare instances, a herniated disc can compress the entire set of nerves. This can cause permanent weakness, paralysis, loss of bowel and bladder control, and sexual dysfunction. If this occurs, emergency surgery is the only option. Seek medical advice if there is any bladder or bowel dysfunction. The weakness progresses and prevents normal activities. There is increasing numbness around the inner thighs, the backs of the legs, and the rectum. Diagnosis. A doctor can often diagnose a herniated disc with a physical exam. They might check reflexes, possibility of tender regions in the back, muscle strength, range of motion, walking ability, sensitivity to touch. An X-ray can help rule out other conditions with similar symptoms. Other types of imaging can provide more details as to the location of the herniated disc, such as MRI or CT images. This can pinpoint the location of the disc and the affected nerves. A discogram. This involves injecting dye into the soft center of one or more discs to help pinpoint cracks in individual discs. A myelogram. This is the process of injecting dye into the spinal fluid, then taking an X-ray image. A discogram can show whether a herniated disc is exerting any pressure on the spinal cord and nerves. Prevention. Tips for preventing a herniated disc include avoiding obesity or losing weight if necessary, learning the correct techniques for lifting and handling, resting and seeking help if symptoms occur. Although it can sometimes be extremely painful, a herniated disc has many promising treatment options.